Nature Solutionaries is a podcast about conservationists who do amazing things for nature and bring inspiration into our lives. Hi, welcome back to Nature Solutionaries podcast. It's been a while since I've produced an episode, and that's mostly because I was working on a different project called Population 8 Billion Podcast for the nonprofit Population Media Center. The good news is I'm back on the air, and I can't wait to let you know about all the interesting projects that I have come across in the last year. Even though this podcast has until now been almost exclusively focused on conservation, my interests have grown into the field of family planning, women's empowerment, and sustainable population. That's why in Season 2, I will be interviewing people from organizations that integrate family planning and sexual and reproductive health and rights with conservation efforts. One of my first guests is Joan Castro, a licensed physician who has more than 20 years of experience in sustainable and community development initiatives in rural and urban settings in the Philippines. Joan serves as the Executive Vice President of Path Foundation Philippines, a nonprofit hosts programs on improving public health, alleviating poverty, and promoting environmentally sustainable development have reached hundreds of thousands of Filipinos. Joan, I'm thrilled to have the opportunity to talk to you. Dr. Karen Hardy, a social demographer, told me a lot about you and the great work that Path Philippines is doing, so thanks a lot for coming on the show.
Hi, Veronica. Thank you for having me and for your interest in Path Foundation Philippines work. And welcome also to your listeners.
Thank you. Path Philippines takes population health and environment approach to human development and conservation. Could you explain the approach and what's unique about it?
This is an integrated development solution that recognizes the interconnectedness dynamics between people and their health and other development aspects, and the goal of which is to improve human and ecosystems well-being. What is unique in this PED or PHE approach is that there is a purposeful integration of the sectors, which means the design, the planning, the implementation takes into account both conceptual and operational integration of the interrelated factors.
How did Path Philippines start with the PHE approach?
PFPI started as a health organization just doing HIV/AIDS. But we've seen when we were working on HIV and sexually transmitted infections as early as 1990s, working with sex workers, in women and men in the sex industry. So we heard stories where these young people would migrate. They were coming from resource areas who used to be very rich in biodiversity, but then they come from a huge number of families, and they need to provide for the younger children or even to their parents. They want the better lives for themselves, and that's one of the options that they were able to get into the sexual industry, which we happen to work in. And so we overlaid all of those issues. Why is this happening? How can we look at the roots of these issues? Because you cannot just provide, health education and treat them with their sexually transmitted infections or educate them how to prevent HIV/AIDS. But we looked at the other issues. Why is it leading them to this kind of work? And so that's where we started to understand those interrelated issues, that if you are healthy and the resources are healthy, then maybe you would able to prevent young women from migrating to the main cities to be able to look for other jobs, but stay with their families and get better in their communities. So and then we looked at population momentum. So these are also where high resources are and are priority areas for conservation. These were also the areas where population momentum is high. and where poverty is very, very high as well. And then we've learned that the fisher folks, and that's because we were working in the coastal communities, are also the poorest of the poor. So all of this came together that with a PHE approach, we were able to look at the roots of the social issues. As a doctor, you think of it like I can treat a patient that you don't have, you'll be healthy tomorrow. You come with a tonsillitis, I'll give you medications, but I don't have to understand the whole thing. And so when you look at population health and environment, then you see everything is interconnected. That it's not only treating this person, but if you go back to these communities, and maybe you'll prevent a lot of the issues.
I didn't know that you initially started focusing on HIV and then you understood the deep-rooted problems that lead to people contracting HIV, and then you started expanding your horizons and seeing that everything is interlinked, and then you also started seeing other. Wow, that's very interesting.
In 2000, we started with 4 areas. And when we ended in 2013, we covered 33 municipalities in the Philippines.
Out of how many municipalities?
Over 1,000 municipalities. So it's we have a long way to go in terms of covering a bigger number of communities, so that there is going to be a collective outcome of the result, that the communities will experience the benefits of integration. So that's within country. In the other countries beyond the Philippines, we were able to scale it up or replicate it in East Africa and in the Pacific Islands. So we worked in Kenya, Tanzania, Ghana, Uganda, Papua New Guinea, for example. Those are the countries where the approach was also replicated.
Okay, now that we explained what PHE approach is in theory, I'd love to give listeners an idea of how it works in practice. Path Foundation has done a number of projects in the last 27 years, but one of the projects that got me interested is the Balanced Project. This project promoted PHE approach in 2 globally significant biodiversity areas called Danajon Bank and Verde Island Passage in central Philippines. And you worked on it together with Conservation International and the Coastal Resources Center between 2010 and 2013. What was the initial problem in this area that made you decide to start working there?
These 2 sites are considered priority, both high or very high priority areas for marine conservation. The Danajon Bank is one of only 3 double barrier reefs in the Indo-Pacific region, while the Verde Island Passage is considered the center of the world's shorefish biodiversity. So the population, there's a lot of communities around these areas, and they rely on the resources of these areas for food, livelihood, and income. What we noted in these areas is that there was biodiversity loss, which was resulting in decreasing fish stocks that supports the food and the livelihood of a rapidly growing population in the area. When we were starting the project in these areas, we noted high rates of population growth, density, and population momentum. So these are the ages between 1 and 15, which would potentially drive the population in the next decade. So these numbers in these areas, in the communities around these areas, were higher than the national rates. So these were the issues that made us decide to start working in these communities.
So, what solutions did you come up with, and how exactly did you implement them in these 2 areas?
We had key initiatives that relates to provision of family planning and reproductive health services to the communities. So we establish community-based distribution and peer education system, and this was to improve the contraceptive supply. We use the social marketing approach where we work with small convenience stores in the villages, and usually the traditional way where they get services would be through the health centers, which are not open after 5 p.m. and mostly they are served by midwives on a scheduled basis. So providing the service, enabling and empowering the communities to be able to deliver the services within their villages was a welcome development. We also did behavior change communication. So we trained peer educators to be able to educate their peers, women, fishers, and youth who disseminated integrated family planning environmental messages for the communities and for policymakers to increase awareness and support for integrated approaches. We also on the coastal resource area, we helped establish marine protected area management, and that included strengthening of enforcement, like supporting and training sea wardens. We also provided for conservation-based enterprises, particularly as we were implementing and supporting marine protected areas, because that limited their access to the waters where they used to fish. So those were some of the basic and key packages that we implemented, and this complement of services were actually what worked during an earlier project of PFPI, which is called the iPopcorn Project, which was an operations research initiative that proved that integrated population and coastal resource management approach yielded higher results than sectoral programs that were implemented in isolation.
You mentioned family planning, and I'm interested in that. The Philippines is predominantly a Catholic country. So I'm wondering, how was birth control perceived by the local communities prior to your outreach, also with regards to the religion?
Yes, the Philippines are 82% Catholics, and we had various reception from all the areas where we were implemented. In some areas we were welcome, in some areas we were not. There was even one site where they did not want us there. So those were initially what was happening at the start of the program. But I think the success is that we pursued, and I think that is the benefit of the integrated approach, because you are also addressing the other needs of the communities that matter to them. Family planning also matters to them. You talk to the youth, the training of the peer educators among the youth had actually even was very helpful to the project, because they were the ones who were convincing their parents to practice family planning and spacing of their families because they were affected. I think the beauty of the integrated approach is that the vision and the goal of the project resonates with what the community and the households believe in, their aspiration in life, that they want food security, and that was part of the overarching theme of the project that we were doing, and their vision that hopefully their children will continue to enjoy the resources that they've enjoyed. So I think that kind of aligning of vision of both the project and the aspiration of the households work in these integrated approaches. Just probably to share with you that when we introduced the PHE approach, they were saying that that is how they actually solve their problems. They don't solve problems like I have a problem in health, so I go to a health center there, or my fish catch is low, so we need to do this. What they think is that there has to be food on the table. So it's really food security. I want my children to get educated. I want them to experience uh, the same resources that I have enjoyed. So that was the rallying point of the project for the communities. So that's the beauty of integrated approach.
So basically, the people understood that if they wanted to feed their families sustainably and over a long period of time, it would be better for them to have fewer children.
Yes, and spacing their children if they want, because for the program that we promoted is voluntary and you have informed consent. So we provide them with information. So if they or should they decide to have the number of children that they want, we would support them. But they want them, so it's not really controlling the number of children, but it's really making the women and the couples decide how many children they want, what kind of contraceptive they want, and when they want it.
Yeah, that's great. I also believe that every woman should have the choice to decide whether she wants to have kids, which is often for many women not the choice. They can not have children. But yeah, I think women should be free to decide whether they want to have kids, when they want to have kids, how many kids they want to have. And spacing is also very important. So I'm wondering whether prior to your outreach, the people living in these areas were practicing any birth control, or how did they perceive it?
They were aware of family planning because there are already ongoing programs. They were aware of contraceptives, both the correct ones and the myths and misconceptions. So that is the general awareness. So the role of the project was also to correct these myths and misconceptions. And there were a lot of them.
What type of myths and misconceptions were there?
One of the common ones that we would encounter is that when they use family planning, like an IUD, for example, is that they cannot carry something heavy. Or when they use contraceptives, then their libido, their sexual drive will decrease, and so on and so forth. So what's interesting is that when you do an education, you have to educate not only the woman, for example, or the man for condoms and vasectomy, because we promoted all the modern contraceptives available. But you have also to educate the mother-in-law, the father-in-law, or the children, because they are part of the decision making of whoever is accepting it. So that's the challenge that you have to be able to overcome. So when you prepare your materials and what kind of messages, you have to be considerate and understand that there are other dynamics that come with decision making.
You're totally right that it's not usually a decision of the woman. She also lives with a man, and very often she lives with an extended family. So it's a good idea to educate everyone about voluntary family planning. And I think that another factor that is important are social norms. So, did you address that in your education?
Yes. So we know that there are traditional roles that that's already there. So that's part also of the education that we have to do. In fact, when you work with indigenous peoples, you have to work with the elders. Believe that the role of the woman is to have babies and to stay at home. And so all of those things need to be considered in terms of developing messages that are culturally appropriate, and that will actually matter in terms of, again, providing the environment that even when the woman or the man decides, will have that environment that make them sustain to continue to use the method that they have decided on. So yes, those all of those things were mattered in the project.
I wish women were asked more often what they want. I feel like because we live in a patriarchal society, unfortunately, women are often the last one who make decisions about their lives and also about making decisions on family size and so on. So you worked in this area for 3 years. What results did you get in the field of public health or in the uptake of birth control?
We were able to increase the contraceptive prevalence rates, at least in the areas that we work in, by increasing also the points of services from village health center to more convenience stores that were able to deliver pills and condoms, and peer educators who are couples, women and youth and fishers actually increase the accessibility from, should we say, Monday to Friday, 8 to 5 to night 24/7. So I think those are the reasons why we were able to increase contraceptive rates in these areas. There were additional delivery points that were able to provide for these services. And if they had questions, like peer educators who would respond to their questions even when they had readily available. In the area of conservation, we actually improved management of close to 2,000 hectares. We helped establish 44 marine protected areas and two marine protected area networks. So those are, I think, huge accomplishments for the short duration of the project, because we work with people's organizations. We work with communities because we had the aspiration that when we leave, they are also able to continue the gains of the project. In terms of sustainable livelihood, so while we work with people's organization, we also supported them with sustainable livelihoods, including building their capacity to manage the funds for their entrepreneurship programs. And we work with local government units, which means that we build local capacity for them to continue to monitor the programs beyond the project. So we were implementing the project with already knowing that we are leaving the project to them, and so their ownership of the initiative was very critical.
What's the situation in these two regions now in terms of the conservation, public health, and family planning? Because it's been about 10 years since you've left, so do you have any insight into how the situation is there, how things are going?
When we were starting the project, the population growth rate was about 2 point something, 2.5, 2.6 in various areas where we work. Now it's 1.9. So I would, even the fertility rate is lower than when we started the program. While it's a national data, I would like to think that that maybe we contributed to that, along with the other programs that were existing. So it may not be fair to say that we were the ones, but I'm sure that the work that the communities put in were sustained, and I think that also mattered why the numbers are getting better.
And besides family planning, did you address any other public health issues?
Yes, HIV/AIDS and sexually transmitted infections were part of the initiative. We also had water and sanitation and malnutrition. So, because this is a food security program, the fact that we were working on ensuring better catch for the future would resonate to better nutrition, particularly of the children.
All right. And in terms of the food security, what exactly did you work on with the fishermen?
With the marine protected area management, we were able to build their capacity to manage the resource. So, for example, most of the marine protected areas were looking at managing the mangroves better, managing the coral reefs, which is where the breeding area for the fish, and the coral reefs would be the major habitat of the fish. And the experience was that there was already decreasing fish catch prior to the project. So that was one of the impetus of the project, because of loss of the biodiversity, loss of destruction of coral reefs, destruction of mangroves. So that part wherein we were able to help them manage or improve management of the marine protected area would now provide a better habitat for the fish and where they breed. And that would contribute to a better fish catch and for the families and for their livelihoods.
So if people could catch fewer fish because there was already, as you said, the bycatch was lower, how else could they earn a living or sustain themselves?
Well, they would engage in also in farming. So they are part-time farmers when the seas are rough and they are unable to fish. So they're into other things. So that was where the livelihood enterprises came in. So we work with women to be able to be engaged in improving their fisheries post-harvest and also engage in even backyard gardening. So that's the to improve the nutrition of the children, particularly those with young kids. So that's both for their families. They raise enough vegetables not only for their families but to sell to the community. So those were some of the samples. There's also some livestock and some piggeries and chicken and other livelihoods that they were engaged in.
And tourism as well, because these are highly attractive areas for tourists.
That's correct, yes.
When you look back at the project, what do you see as areas for improvement?
I think in general, I think that we still need to, because it's still there in terms of being traditional, the structure of the system is still stovepipe. So what we need to continue to do is continue to engage in with policymakers, engage with donors to be able to pass policies on integrated approaches and invest in integrated approaches compared to to investing and more policies in sectoral approaches. So I think that needs to be done and that needs to be amplified as well.
If we can see that the PHE approach brings more value over single sector efforts, why do you think that it isn't more widespread globally?
The systems that we have that are in place are still very much sectoral in nature. So what we need to do is to be able to advocate, provide more evidence that the integrated approaches result in synergy and value added results so that policymakers and donors would be able to invest funds and policies and programs, particularly an integrated approach.
Thanks for your insight. You put it nicely. After you finished working on the Balance project, you launched a couple of other projects, and during the COVID pandemic, you started a new project with the support of USAID and in cooperation with the African Institute for Development Policy, Leadership for Environment and Development, Southern and Eastern Africa, and Pan-African Climate Justice Alliance. What's the aim of this program?
The project is called BUILD, or Building Capacity for Integrated Family Planning and Reproductive Health and Population, Environment, and Development Action. This is a policy advocacy initiative which aims to amplify the PED nexus across sectors and geographies. And this is by building individual and institutional capacities towards increasing political commitment, sustained financial resources, and accountability for voluntary family planning and reproductive health. So this is the part, this is the project that hopefully we graduate from models to be able to expand the project through capacity building of institutions and individuals. So more champions, more individual champions, and more champions who are coming from institutions or even institutions that are championing the PED approach.
So practically speaking, this project is supposed to support institutions that I mentioned in applying PHE approach in their work.
The institutions that you mentioned, like AFIDEP, LEAD, PACCHA, and PFPI are the implementers of this project. So there are 4 hubs. So we have a hub in Malawi, we have a hub in Cote d'Ivoire, we have a hub in Kenya, and the hub where PFPI works is the Asia Pacific hub. So the idea is to work with low to middle income countries that are priority areas for family planning. These countries that I mentioned would be the hub country, and we hope that we will be able to amplify the PED actions from within country to the other countries of the region. So for example, Asia Pacific, Malawi for Southern Africa, West Africa for Cote d'Ivoire, and Kenya for Eastern Africa.
And what organizations will you be working with?
PFPI will be working with organizations, agencies, government agencies in the environment sector. We'll also be working with those that are working in the climate change platforms and on sustainable development. So those including health, of course. So we work with PHE networks in country if there are, to be able to amplify or to help us amplify the PED approach in the region. So we're working not only in the Philippines, so we're reaching out also to non-government organizations in other countries like Nepal and Bangladesh and Indonesia. So we have some organizations right now who are doing integrated approaches, maybe not calling it PED. Some do call it PHE or PD, but we're trying to consolidate this effort. So we're harnessing the power of these organizations to be able to amplify the PED approach, at least regionally, in regions where we work in.
In my next interview, I will be talking to the founder of a nonprofit called Conservation Through Public Health. They're based in Uganda, and they also apply the One Health approach. So I look forward to that. Maybe you will also work with them. Who knows? As our time will soon be up, my final question is, what motivates you to continue this work and who inspires you?
When I go back to the communities, because there's always an opportunity to go back, and with the stakeholders that we work with, it gives me a lot of motivation when I hear them remember the work that we did on PHE. And that when they tell the stories themselves in their own words. So I think that's actually a great motivation. And close to 3 decades of advocating PHE, I think the growing community of PHE advocates continues to be a motivation for me. So it's the results of the work that we do continue to be my motivation.
And is there anyone in particular who inspires you?
I have mentors. I'd like to mention Leona de Agnes, who is actually a leading pioneer of integrated approaches. She was 10 years ahead of her time, and she was able to think through the integrated approach. She had an agile imagination that responded to, or the vision of what is in the future. The Secretary of the Department of Environment and Natural Resources was very supportive of our work. He was the father or grandfather of marine protected areas, and he's known globally. Dr. Angel Alcala, who just passed very recently, was a staunch advocate of family planning. He believed that if we do family planning in communities where we do also community-based marine protected area management, then we will make the lives of the communities better, especially the women.
Joan, thanks a lot for the interview and even more for the amazing work you've done over your lifetime. It's truly inspiring.
Thank you. Thank you, Veronica, for this opportunity to tell the story.
If you want to learn more about Path Foundation Philippines, check out the link in the show notes. Thank you so much for listening to this interview. It means a lot to me. If you like today's episode about integrated approaches to saving our planet, I'd like to encourage you to start a conversation today about this topic with your partner, friend, or colleague. You can bring up this issue and see what people think. Do they agree with you? Are they against it? There's nothing more powerful and life-changing than having a profound discussion. And of course, I'll be happy if you spread the word about my podcast on social media and subscribe to the podcast in Apple Podcasts, Spotify, or Google Podcasts. Well, that might be quite a lot of tasks already, so just pick whatever feels best for you. In the next episode, I'm going to interview Dr. Gladys Kalema Zikusoka, Uganda's first wildlife veterinarian and founder of Conservation Through Public Health. We'll touch on the coexistence of endangered mountain gorillas, other wildlife, and people in Africa, and about the importance of addressing public health. For more information, visit veronicaperkova.com/podcast. I'm Veronica Perkova, and I look forward to talking to you soon.